I see a lot of patients that are actually IUGR and preterm deliveries. And I have several hypoplasts, for example, that have been born at 34, 35 weeks. And so I'm thinking they're 35 weeks, their brain's like a 31 weeker. And it's in all that chronic care. We talk about the toxic stress and all these things that the neonatology field are savvy about, right? And know about. But I think about all those things and what that baby has to go through by the time they leave the hospital. And some of them don't leave the hospital for 6 months. They go through a temporizing procedure, then they have their Norwood and they're not growing and thriving. So then they're not feeding well and can't gain weight because they're IUGR and they're preemie or former preemie, and then they stay till they're Glenn, and then they finally go home. And you think, what is going to be the impact on that baby's neurodevelopment? So it's multiple levels of when you look at the challenges that these babies have to go through. And that's really the extreme cases. The straightforward is you go home after a few weeks, and even those kids are at risk for problems from a neurodevelopmental standpoint.